I'm curious about the dissemination of the curriculum, the innovative curriculum that was being done at UNM and in conjunction with the Education Committee at University of Chicago, and how that then got out to other medical schools. You said it wasn't until the 1980s that Harvard adopted a similar curriculum, so I just wondered how that got out and about and how widespread it became.
That's a very good question, and I don't know the answer. What we developed in Chicago with Ben Bloom and John Ginther, who were professors at the University of Chicago, and they were in the Department of Education. The key player, actually, in getting the group together was a Thomas Hale Ham and John Harris from the Western Reserve in Cleveland, later to become Case Western Reserve. And they were really the motivators of getting, I would say there were 15 or 20 of hematology, young hematologists, by the way, people like me in their early 30s, who got together to develop the curriculum for teaching hematology. So far as I know, that approach was adopted in a number of schools. I don't know in hematology, but we were sort of the only school that was being formed at the time. So as far as I know, it was not applied system-wide through the whole medical curriculum in other schools at that time, although it might have been. I don't know the answer to that. I would add one other thing relating to curriculum. In the first 2 years, when I was curriculum chairman, actually I was curriculum chairman for the first 4 years, and then Bill Hardy, a member of the hematology program, became curriculum chairman. But in the first 2 years, when I was asked to do this, we were only a 2-year school. And so I was really only worrying at that time about the first 2 years. And we had made preparations in the early spring of 66, when the students would be going on to other schools to place our medical students in other medical schools around the country, which we did. But then the legislature in the spring of 1966 approved UNM for a 4-year school. And so none of our students had to go. And then we got busy planning the 3rd and the 4th year.
It's interesting what you're saying, because you were doing an innovative curriculum for students who would then have to mesh with schools which were running a more traditional curriculum. So your innovative curriculum must have actually covered in the first 2 years everything that the regular curriculum would have covered in the first 2 years, just in a different way, in order for that to be a successful mesh. It didn't actually have to happen, but as you were planning it, you had to figure that they had to go in and successfully go to 3rd year with students who'd been exposed to a different order of processes.
That's true, and we, as I mentioned, in traditional schools there were 6 subjects that were the basics of the first 2 years. And these 6 subjects had to be brought up in relationship to the organ systems that we were covering, both the normal in the first year and the abnormal in the second. So the basics, probably not as thoroughly as was covered in other medical schools. So I don't really know how the students would have done at other medical schools, because the experiment was never done.
You got kind of lucky in that the 4 years.
So we never found out how that worked. So,
And of course, it's always the what if also, because that would have been an interesting thing with those students, seeing how they did would have been a way of the other schools seeing how your new innovative curriculum worked on the first 2 years, comparing their students who'd gone through the traditional curriculum going into third year with your students entering their school on the third year and how they would have done. And we never know.
the, um, okay.
Okay.
Yeah.
All right. Do you want to tell us a little bit more about how the medical program got integrated into the Maine medical community at UNM?
I'll try to remember something of this. This was a very significant aspect of actually satisfaction with coming to the University of New Mexico and participating in the development of the School of Medicine. The chairman of medicine, Solomon Papper, who recruited me, was an outstanding physician, teacher, and human being. And he made sure in his many imaginative ways that the Department of Medicine, of which I can speak most informatively, was integrated into the community. In many areas in which there are medical schools, there are conflicts between so-called town and gown. The problem arising that if patients are referred to physicians at the university, the patients stay there and don't return to the referring physician. Dr. Papper made sure that this was not would not be the policy at UNM School of Medicine, so that the relationships between the physicians at the university and in the community, at least in the Department of Medicine, were excellent. And all of us members of the Department of Medicine benefited enormously from that relationship because we obtained outstanding requests for consultations and therefore were able to develop better programs for our students and hopefully render a service to the patients. So Dr. Papper gets an enormous amount of credit for that. Another thing that is relevant to the early developments, in New Mexico in the late 60s and I believe early 70s, abortion was permitted, provided the patient received permission from a committee. Whether that is a good or a bad policy, I will leave for other judgment. In any case, at the university, such a committee was formed between composed of a psychiatrist, an obstetrician, and an internist. And I had the privilege of serving as the internist on that committee. And we functioned very responsibly. I made it a point that the woman being interviewed would be interviewed by only one of the three at a time, because I thought it was a daunting experience for a lady who wanted an abortion and had to face three men all at once. We probably, over the course of my service, saw maybe 24 dealt with 24 requests, and we approved every one of them but one. And that's a little story in itself. Suffice it to say, the woman whom we refused was simply delighted by our refusal, because she was being pressured by her husband to have the abortion. She had 4 children already who she cared for with love and devotion, and she had no problem dealing with another one. So our refusal in that case worked to her benefit. The reason I bring up that committee is that it was somewhat relevant to, at the time of the first graduating class, they wanted to choose an oath. A committee was formed, and I was privileged to at least be asked about my views about it, but I want to say in the outset that the choice was totally the students' choice. They had reservations about the Hippocratic Oath because it was in many ways outdated and no longer relevant to the current time. It also put a restriction on a physician performing abortion. It was an implied restriction, not a total restriction. And that was uncomfortable to the class. They then reviewed the Oath of Geneva, which was an oath created after World War II and was much more relevant to the current situation. It also had an implied restriction on the use, on a physician assisting or helping performing an abortion. And the students simply voted to omit that phrase so that the dignity of human life was preserved, but it was not specified in any, it was left to be left at that without any further amendment. And I was privileged to be selected by the second graduating class to administer the oath, something that made me feel very good. I want to say a few words about the hematology program. As I mentioned before, when I was recruited, there were 2 physicians specializing in hematology in New Mexico. There was one at the Lovelace Clinic, Bill Hardy, and then when I came there was a second one. And I certainly got a lot of consultations and referrals, particularly in areas of hematology, which we could manage very well, but also in terms of hematologic malignancies, leukemias, lymphomas, which we were not set up to handle very well because we lacked facilities for radiation. We lacked adequate support for transfusion, and we lacked adequate microbiologic support, which we desperately needed when patients are immunosuppressed and are susceptible to infection. So we approached this in several ways. I was able to obtain a hematology training grant from the National Institutes of Health, which allowed me to set up a program to train the technologists throughout New Mexico to perform basic, high-quality hematologic tests and send us the reports. We were aware, acutely aware, that when a patient is ill, they need to be as much as possible kept within their family for obvious reasons, mainly to be supportive. So with this, having seen a patient in consultation in Albuquerque and then sending the patient back into the community and having technologists trained to perform high-quality tests, the results of which could be sent to us, that gave us then several options. And the first option was, could the patient be managed in his local community, which was our first choice. The second choice was, could we manage it better in Albuquerque than in the local community? And that was an option. Third option was, when we were aware that better therapy was available elsewhere, we then sent the patient to 4 possible places. One was for transplantation, which was in its early stages, but well carried out in Seattle. So for bone marrow transplantation, they went to Seattle. For radiation therapy, they were referred to Stanford under the incredibly imaginative care of Professor Henry Kaplan. Seattle, I should mention, Don Thomas's unit, for which he got the Nobel Prize. Henry Kaplan was an outstanding leader in radiation therapy for hematologic malignancies. And finally, for chemotherapy, the MD Anderson Hospital in Houston and the National Institutes of Health were the leaders in that field. And so there's where our patients went. The hematology training program enabled us to do a couple of other things. It allowed us to establish a fellowship program in the hematology division. And we were fortunate that what I considered was the best chief resident we had in the medical department chose to be a fellow in our hematology division. That was Dr. Jack Psyche, who then went on, after we sent him to MD Anderson, to be trained in medical oncology, which was a new field at the time. He returned as a faculty member in the division of hematology, and ultimately, as is well known, he became the beloved head of medical oncology in the Cancer Center at the university, which developed in the late 70s. I should also mention that by the time he became a faculty member, we had also recruited the other hematologist in the state who was at Loveless, who became the second member of the Division of Hematology. He, as I mentioned before, took over the chairmanship of the curriculum committee. I think it was in 1968.
And what was his name?
That was Bill Hardy.
That was Bill Hardy.
So, so the training program enabled us to have a fellowship. Another member who turned another individual who had a fellowship with us was Hank or Henry Sayers, and he was a graduate of the third graduating class, the class of 1970. He took a fellowship in hematology and then also became a faculty member in the division of hematology. So that was the first medical student trained in New Mexico totally who became a member of the faculty and the division of hematology. And while we're talking about, there's one other thing I'd like to say, that the hematology program also had a rotation, of course, for medical students. And I recall that there were two medical students, Carol Fellows and Henry Lauderbaugh, part of the class of 1972, who took the rotation at the same time and fell in love. And several years later, after I had left, they married, and I was honored and flattered. I was at the Bethesda. I was in Bethesda at the National Institutes of Health at the time, but they invited me to the wedding. And the wedding took place at the museum at the Albuquerque airport. And so I flew there and was an honored guest at their wedding, which made me feel very good and put tears in my eyes, as it does now. They went on, Carol Fellows went on to be a well-known radiologist, and Henry, I really have forgotten what he has went on, but also an outstanding fellow. Which brings me to the question that came up at the beginning: how effective might this was the perception by the students of our curriculum? Well, I can only say that there was an award chosen by the class of 60, the first class. It was not called the Catali, but it had another name, and the award appropriately went to the dean who made the whole thing happen. The second award, the class of 69, the award went to Bob Sinescu, an absolutely wonderful, wonderful human being who was chairman of psychiatry. Unfortunately, he was a heavy smoker and died within probably 3 or 4 years of lung cancer. The class of the third graduating class, the class of 1970, presented me with the Catali Award, and I wrote down on a piece of paper the inscription, which I will read. It's very brief, but it was selected by the graduating class to be awarded to the faculty member who, throughout the 4-year period, has shown the most consistent awareness of his primary duty as a teacher of medical students. And Eve, my wife, knew about this before, 6 weeks before I did, because she had to supply a picture for the yearbook. But when we went to the graduation ceremony, I had no idea. And they called up 6 people who had been candidates. 3, by the way, were members of the Division of Hematology. And then they read out my name. And I must say, that was maybe one of the most wonderful moments, certainly at the University of New Mexico, and a memory that I cherish to this day. I would say that the year 1971, Bill Hardy received the Catali Award, and in subsequent years, Jack Psyche received it more than anybody before or since. He received it multiple times, probably a half a dozen times, if not more. And so at least there was appreciation by the students that this approach to teaching met what they thought was their needs.
As did the teachers.
And I think I'll leave it at that.
That's a pretty gratifying feeling, both for yourself as an award winner and for the department you built and the curriculum you designed, that they felt that the people teaching it and what was being taught was so effective and so helpful and warm and wonderful for them. And that's a pretty cool thing to have.
Thanks, Carol.